In Parkinsonism disease. So first you have to know what is Parkinsonism. So Parkinsonism is a disease which is related to again disorder in the brain and with neurotransmitter dopamine. So dopamine release is reduced in aged person. Particularly this is happening in aged person. So who is having lack of dopamine, they may face this problem. So what are the problems? Mostly tremors, rigidity, and unable to move properly. Okay, fall down while moving, fall down. So there is no proper reflexes occurring. Motor coordination is disturbed. So this is regarding extrapyramidal motor disturbances. So extrapyramidal means there is a region in a brain which is present in cerebral cortex towards the spinal cord. Okay, so the nerves connecting from cerebral cortex towards spinal cord and through the peripheral nerves, it is connecting to arms and legs and all other organs. So if that motor cortex and extrapyramidal region is disturbed and release of dopamine is disturbed, then this disease may occur. So Parkinsonism is nothing but extrapyramidal motor disorder which will cause rigidity, stiffness and tremor and brady or hypokinesia, means lack of movement or slow movement, or lack of movement. Then symptoms: dystonia. What is dystonia? Like this only: continuous spasm and muscle contraction. So spasm will occur, okay, rigid formation and muscle contraction will occur. So rigidity, toughness will occur, dystonia. And there is no tonicity present in the muscle, means contraction and relaxation is the regular function for a skeletal muscle. So it is disturbed and rigidity, stiffness is coming. So spasm and muscle contraction is continuous. So that is called dystonia. Then dystonia is over. Now akathisia. So akathisia means motor restlessness. So somebody, if it is happening in somebody, so he may feel restlessness. He cannot sit in a particular area for more longer time. Okay, so that is called restlessness. So this is akathisia. Then tremor and tardive dyskinesia. Again, what is this? Irregular, jerky movement and postural reflexes lost. Postural means he or she may not stand properly. So postural reflexes are lost because of nerve are not properly working. So whenever after sitting and after certain time, if he is going to stand up, he may fall down. Okay, so like that will happen. Or after getting from lie down, he may fall down again. So like that. So postural reflexes will lost. Then Parkinsonism disease described by Sir James Parkinson in 1817. So this is the scientist name who described this disease name. So by his name only it is kept as Parkinsonism. Okay. So in 1817, mostly in old age it is occurring. Mostly in old age it is occurring. So now Parkinsonism is of two types. Number one is idiopathic Parkinsonism. Number two is secondary Parkinsonism. Idiopathic Parkinsonism is Parkinson's disease. This is the main disease. Okay. And secondary Parkinsonism, because of some trauma, because of some infection, or because of some drug usage, it may cause. So secondary, because of secondary other side effects, it will occur or it will cause. So that's why this one secondary Parkinsonism. But this is actual Parkinsonism which is developed as a disease. Okay. So secondary Parkinsonism due to infection, due to toxins. So due to infection, post encephalitic Parkinsonism means if certain virus is affecting the nervous system in the brain, then it may occur. So caused by viral illness, if certain virus is attacked. Okay, suppose for example flu is there, Okay, flu is the virus or encephalitis. So viral disease, if someone is attacked by viral disease, so it may cause, okay, so viral illness which trigger degeneration of nerve cell in substantia nigra. So if he or she may be affected by viral illness, so what will happen? Nerve cell in the substantia nigra will be affected. So what is substantia nigra in brain? So this is the rough diagram of brain. So this is here midbrain is present. So this is in basal, means base of the midbrain, okay, ventral side. There is a substantia nigra, okay. So substantia nigra is a region in midbrain which is present in basal ganglia in midbrain. So this is about substantia nigra. So it is affected because in substantia nigra dopamine is more, concentration of dopamine is more. So all regions, other regions also dopamine is there, but in substantia nigra it is more concentrated. Okay, so if it is affected substantia nigra, then decreased of dopamine. Okay, then this is the structure about basal ganglia. So this is globus pallidus, this is globus pallidus, this round one, this one globus pallidus, and beside this one, beside this area globus pallidus, besides around that one putamen is there, and again this one is elongating, and this is called as basal ganglia, okay, all together, and this is caudate nucleus, this one, this end is caudate nucleus. So all together is called as basal ganglia, okay. Then due to toxin, because of manganese or cobalt poisoning, it may occur also secondary Parkinsonism, okay. Then third one is degenerative disease of CNS. So because of degeneration of the CNS disease, like psychiatric disease or antidepressant disease may also have this type of problem, okay. So like Wilson's disease, which is due to copper poisoning, okay, Wilson's disease because of copper poisoning. So in idiopathic Parkinsonism, there is degeneration of the dopamine containing neurons in substantia nigra. Already I told you, degeneration of dopamine neuron containing in substantia nigra, resulting in dopamine deficiency. Then hence the balance between inhibitory dopaminergic neurons, so disbalancing occur, okay, disbalance happening here, dopaminergic neurons between dopaminergic neurons and excitatory cholinergic neurons. So dopaminergic neurons firing dopamine, okay, which is responsible for balance of the muscles, okay, and excitatory cholinergic neurons like acetylcholine, okay, which is giving excitement or contraction of the muscles. So between dopaminergic neurons, means between dopamine neurotransmitter and excitatory cholinergic neurons, neurotransmitter is acetylcholine. So between dopamine neurotransmitter and acetylcholine neurotransmitter, balance is disturbed, so that this disease or disorder will occur, Parkinsonism. So it is disturbed, okay. So this is about Parkinsonism in short, okay. So what is the disease? So what are the drugs which are used for Parkinsonism? So classification of the drugs which may used for the relief from the Parkinsonism, okay. So number A is dopamine precursor. Dopamine precursor means which will produce, precursor means it is the precursor which is producing or inducing or producing dopamine, okay, like levodopa, L-dopa, okay. Then second category, B category is dopamine agonist, which is working as agonist, means like dopamine it is working, so that is bromocriptine and pergolide, then pramipexole and ropinirole. So these are the drugs dopamine agonist, which is work like dopamine, okay. Then C, dopamine releasing drug like amantadine, okay. then MAO B inhibitor. So in previous video about antidepressant drug, I had discussed about MAO A inhibitor. Okay, here MAO B inhibitor. So you can watch through that one. That one later you can watch. What is MAO A inhibitor? So here that is MAO A inhibitor is actually serotonin inhibitor. Okay, serotonin release inhibitor. Okay, and this one actually MAO is monoamine oxidase, which is destroying or degrading MAO. Monoamine oxidase is of two types, A and B. So this monoamine oxidase from mitochondria, it is the enzyme which destroying or degrading the neurotransmitter dopamine or serotonin. If category A MAO is there, it will destroy or degrade the serotonin neurotransmitter to release to stop its release more to the postsynaptic nerve. Okay, so if some drug is used to inhibit it, that is called MAO inhibitors. So here MAO B inhibitor, which is inhibiting, okay, what, to destroy the dopamine, means it is stopping to destroy the dopamine. So that is called as MAO B inhibitor. So this is called drug name is deprenin or seligilin. Okay, so this is the drug. So which is inhibiting this enzyme. Okay, if this enzyme is inhibited by this drug, then there is no destruction or destroying of the dopamine. Okay, so that is the mechanism. Now COMT, this is another enzyme. This is also from mitochondria, catechol O methyl transferase. So this enzyme also degrading or destroying the neurotransmitter. So again, inhibitors which are inhibiting this enzyme, okay, like tolcapone, okay, and entacapone. So these two drugs are inhibiting COMT enzyme. So why these enzymes are released in neurotransmitter? Because it is balancing the neurotransmission firing. Why? If more neurotransmitters are released in from presynaptic neuron to postsynaptic neuron, then excitatory effect or other side effects will occur. That's why it is balancing. For that reason, in our system, neurotransmitters, these enzymes are controlling. But if overproduction is there or destruction is there, then these inhibitors are using to stop the destruction of the neurotransmitter. Okay. Now, seventh one is peripheral decarboxylase inhibitors. So in periphery means in our peripheral system, this is the decarboxylase enzyme, which again destroying or degrading the neurotransmitter. So again, inhibitors are stopping this degradation. Okay, so like carbidopa and benserazide. Okay, so these two drugs are used to stop this decarboxylase enzymes activity, like here. Okay, so now we will see on diagrammatic representation how pharmacological action on the central nervous system of dopamine and on heart and blood vessels. Okay, so if L-dopa, this is the drug which is given peripherally, means intravenously, okay, or orally, then it will go peripherally, okay, dissolving. Then by the help of dopa decarboxylase, it is converted to dopamine, which is increasing tachycardia, means increased rate of heartbeat, and palpitation, means irregular or force rapid action of heart, okay, relaxation or contraction. Then postural hypotension, means whenever someone is from sitting, standing, he may fall because of hypotension, because of lack of blood tension. Okay, so this is happening when dopamine is mixing or circulating in the blood. Okay, so side effect may be as nausea and vomiting. So if it is going to chemical trigger zone, this is chemical trigger zone CTZ in brain, then what will happen? So through here it is triggering the D2 receptor, dopamine receptor. So here you can see L-dopa going. So this is the mechanism. So dopa, by the help of dopa decarboxylase, L-dopa is converted to dopamine. L-dopa by the help of dopa decarboxylase enzyme converting to dopamine, which interacts with D2 receptor in the brain. Okay, and dopamine can cross the BBB, blood-brain barrier. Okay, to the brain. Okay, then in basal ganglia it is reaching. Already I have shown here. This is basal ganglia. Okay, putamen, then caudate nucleus and globus pallidus. So this one pallidus. So these all together are called as basal ganglia. Okay, so there it is reaching, which is the center for dopamine release. Okay, so then relief symptom of Parkinsonism. So in short, what you understood, that lack of dopamine increasing the Parkinsonism disease, which while being some person is aged or older person, they may have the dopamine reduction in the ganglia, basal ganglia, so it causing Parkinsonism, tremors, rigidity, those things. Okay, so this is about pharmacological action of L-dopa. Okay, both in periphery and centrally. Okay, then main aim of the drug therapy of Parkinsonism to enhance dopamine or to reduce cholinergic activity. Means cholinergic activity inducing excitement in the body, contractions will be increased. Okay, so excitement will be increased. So to reduce cholinergic activity and to induce or enhance dopamine secretion, that is the main drug therapy aim. Okay, but every person cannot depend on this drug therapy, because it may only suitable for 3 to 5 years. After that one, whenever blood plasma concentration is decreased, okay, binding capacity is decreased, so again there is no effect on by taking these drugs. So this is the most side effect. Okay, so no one can depend totally on the drug. So how could then relief can be done? So through certain food which is having the amine precursor which is producing dopamine, like tyrosine, tryptamine, tryptophan. These things are the precursors of the dopamine, serotonin receptors, neurotransmitters. So they may take those foods regularly. Okay, so now drugs influencing brain cholinergic system. So what are the drugs which influencing brain cholinergic system? Means acetylcholine release. Okay, so centrally acting anticholinergic drugs. So what is anticholinergic drugs? So these are the anticholinergic drugs: benztropine and benzhexol and procyclidine. So these are the drug which is stopping the cholinergic activity. Okay, centrally acting, these are the drugs. Then antihistamines, which is responsible for allergic reaction. So this is also in brain. Okay, so in particularly in inflammation reaction it is necessary. So H1 blockers also will decrease that reaction. Okay, with anticholinergic activity, like promethazine and diphenyl hydramine, promethazine and diphenyl hydramine. So these are the drugs, okay, which influencing brain of cholinergic system and H1 blockers. Now pharmacokinetic, oral administration of L-dopa rapidly absorbed in the small intestine. So if someone is given oral administration of L-dopa drugs, then it will rapidly distributed and absorbed in the small intestine by active transport. Means it need energy, ATP. Okay, then amino acids may interfere in food. If someone is taking these drugs which is having the foods which is having amino acids, so it may interfere with that drug. So should not take immediately after food. So it is recommended to take before 30 to 60 minutes before meal. Okay, to stop the interference with food of these drugs. Then adverse effects. What are the adverse effects? In GI, gastrointestinal tract, nausea, vomiting, anorexia will occur. So anorexia means loss of appetite. There is no feeling of hunger. Okay. Then domperidone is the drug to control L-DOPA induced vomiting, means because of L-DOPA inducing vomiting or nausea is coming, so domperidone is the drug which can stop that action. Okay, then abnormal movement, dyskinesia, again involuntary movement of the muscles like arms, neck, or facial muscles, or arms or legs or toes. So any muscle, certain areas of the muscle. Okay, dyskinesia, loss of movement. Okay, and tics, tremors. Tics means pinching like sensation. Okay, then tremors, shaking. Okay, then chorioathetoid. Okay, chorioathetoid movements. So this is also regarding face, toes, and fingers. So those movements will be disturbed. Okay, then alteration in smell and taste. Okay, so taste and smell will be altered, so you will not get proper taste. Mental changes what will happen: insomnia, lack of sleep, confusion, and delusions. Okay, not having proper confident, and euphoria, depression, anxiety, hallucination, nightmares may be seen. So these are the side effects. Okay, so here metabolite of L-DOPA is homovanillic acid, HVA. So with after oral administration, all actions is over, then here metabolite of L-DOPA is converted to homovanillic acid and 3,4-dihydroxyphenyl acetic acid, DOPAC, then excreted in urine. So this is the all about dopamine. Okay, then so what is L-DOPA is a prodrug. L-DOPA is a prodrug. Again, I'll show here. So L-DOPA is a prodrug which is going to absorb after oral administration in the circulation, blood circulation. Okay, so in blood circulation or in periphery, what will happen? 3 to 5% of L-DOPA is here itself metabolized. So to avoid this metabolism, if this is happening here itself, so this much only reaching to blood, passing to blood brain barrier, but dopamine cannot if you are directly taking dopamine like medicine, so it cannot cross the blood brain L-DOPA cannot cross the blood brain barrier, and it can be dissolved most of it in blood, and only 3 to 5% only reaching to BBB, which is passing to the blood brain barrier and converting to dopamine. So for this reason we should avoid this one metabolism in periphery. So we are combining L-DOPA with carbidopa. So L-DOPA plus carbidopa, so which is inducing its activity, and it is helping to reach BBB, blood brain barrier, which is passing through blood brain barrier, and it is converted to dopamine. Okay, so by that way converting to dopamine and inducing the action of dopamine. So what is the action of dopamine? So proper balance of dopamine will cause natural activity of the muscle or motor reflexes. If an imbalance is occurring, dopamine imbalance is occurring in substantia nigra or basal ganglia, then it will cause Parkinsonism. Okay, so these are the drugs and this is the mechanism. So hope that you understood this video. So please like, share and subscribe. Thank you.